An important element of running any 340B program is making sure that you are tracking the savings that's generated. We've seen a lot of interest lately, both from manufacturers as well as Congress, on how covered entities are using their 340B program savings. We want to make sure that we're able to demonstrate that our use of savings aligns with the 340B program intent to stretch scarce federal resources to be able to extend services and serve more patients. And with that, we need to know how to calculate our 340B savings. The most basic calculation for 340B savings is looking at the cost of what you would have paid for a medication and then comparing to what you did pay for that medication on 340B. So you may use what's called the WAC, or the wholesale acquisition cost. So that would be the highest price for the drug that we typically see in the market, and then subtract the 340B cost, and that would be your starting point of calculating savings. Another way to calculate it would be looking at what you're usually paying for the drug. So most often people aren't paying the wholesale acquisition cost. They may be in a buying group or a group purchasing organization, often known as a GPO. So you may take your GPO price and minus the 340B price from that and use that as your 340B savings calculation. From there, the next piece that is important to look at is what is the cost of running your 340B program when it comes to your compliance and oversight. So there are many elements that come into play. Things like the staffing of your program within your health center or your covered entity, so the people who are required to do the oversight. And then additionally, other elements like your external audit that you would have each year and the third-party administrators that you're working with that help you run your program. So really important to think about your initial savings calculation of the medications you're purchasing and how much you're saving there, but then also the other costs that come into running that program when you're reporting out those numbers. We have a lot of different places where we are being asked to provide that information. One is that health centers are providing it through the UDS calculations. Another is that there are a lot of transparency requests. So we do have some states that have passed transparency bills that have reporting requirements, and others where we have proposed federal legislation that may implement these types of asks. So FQHCs, you're already doing a lot of this work already, so we're well prepared in the event these types of reporting requirements do come into effect. Another way that you can use your 340B savings information is to be able to advocate on behalf of your health center. So taking that information and showing the benefits of the 340B program to your overall operations, how it supports the provision of services to your community, and also how the 340B program helps your patients who are underinsured or uninsured access affordable medications are really important ways to use that data. There are a few different trends around state reporting requirements for 340B that we've seen. The first is that some states have opted to have hospital-only reporting requirements. The hospitals tend to have a more complex 340B program and also larger volume running through their 340B programs, and the states have been very interested to see both what the savings is and how they are using that savings. Another trend is asking quite a deep dive into the 340B program. So both looking at what is the overall savings in the program, but also intricate asks about the payers that are being involved and having the savings broke down into different categories based on payer or insurance type of the individuals that have been served. Some states we have seen that the requirements are more high level, asking the covered entities to provide something more of a narrative of how they are using the 340B savings that they're generating, along with a breakdown of what their aggregate savings would be. Within the states that are more general, they have followed the American Hospital Association's 340B good stewardship principles. we can anticipate seeing more 340B transparency requirements both at the state level and at the federal level as new laws come into effect. So it's very important for covered entities to be tracking their 340B savings, both for potential future legislations that could come into effect, but also just to be able to articulate how important the 340B program is to your covered entity.